It's James with Net News Ledger. Joining us by Zoom is Thunder Bay Rainy River MP Marcus Powlowski. Marcus, a very busy week, a new budget, a lot of work going on in the background with government. What do our readers and viewers need to know?
Well, this is a budget to help us get through COVID and really get the economy going. Really to ensure that the economy comes out of this strong and continues to be strong for the future. So there's a lot of investment in a lot of different areas, a total of just over 100 billion over 3 years. Now, right away, I think people quite rightly say, what, $100 billion? Like, are you going to be creating a debt that our grandchildren are going to have to pay? And it's a good question. It's something the government ought to be thinking about. But the reality is, as the finance minister said, and I agree with her, that really it's in our long-term best economic interest to be spending money now. And a lot of institutions like the IMF is saying the same thing. When you lose a job and create someone who's dependent on the state, either on welfare or EI, or dependent on government benefits, obviously that's money coming out of the public purse to pay them. But you're also not getting anything back from them in taxes, and they often don't have enough money to go out and spend at the restaurant, at the theater, in the stores, and so there's not the same amount of money going into the economy. On the other hand, if you create jobs and you have to stimulate the economy a bit in creating a permanent job, then that's a job where somebody's going to be making a wage, who's then going to be paying taxes on that wage, who's also going to have a job that they can have some money in their pockets and spend it, which is again money going into the economy to pay someone else, whether it's in retail or hospitality industry. And those jobs too are paying taxes. So really it's in our long-term best interest to have a strong economy, to have people working. And the other aspect I might as well say right away with that is I think the daycare thing's a big one, because I think getting women back into the workforce certainly helps women's single moms, but also families and young families, or even look how old I am. I've got small kids too. I got kids of every age, but for a lot of families, if daycare isn't affordable, one parent has to stay at home. And if the one parent who's working has a low or medium paying job, it can be a financial struggle. But if in Ontario we had, as in Quebec, where they have daycare that's on average like $10 a day for daycare. In fact, it's less than that. In Montreal, I think the average, it's $175 a month is the average cost of daycare per child in Montreal. If we had that kind of daycare that would be affordable to families or even single parents, then really you can afford to get a job. And so it makes it a lot easier in life to get by. I mean, even if it's a part-time job, because some people will want to stay at home and look after the kids. But even if you have partial daycare, you can work part-time. That's more money coming into the family. So I think that's a big part of it. And I guess economists and the RBC estimated that having affordable daycare would bring, and I haven't seen these figures, but I was told by one of my colleagues who's a lot more of a financial guy than I, said that they were estimating that this would bring $100 billion into the economy for the same reason as I started off saying about people who were unemployed. Now women who are staying at home, or people who are staying at home looking after their kids are often not drawing benefits from the state, but nor are they making an income to pay taxes, and nor are they making money to spend in the economy.
And it's been a balancing act for government, because if we don't keep things going right now, how are we going to get them going? You know, if everything's shut down totally, starting it all up is going to cost more.
Yeah, absolutely. And a lot of the programs, like the Canadian Relief Benefit, the wage subsidy, the rental subsidy are going till September, and that costs a lot of money too. So if you're looking for all those nice shiny things in the budget, there are some of those nice shiny things in the budget, but a fair bit of money is going towards sorry, basically keeping people employed. Oh, hold on.
Okay.
We'll grab the phone there. Okay, sorry about that. So, I mean, there is a fair bit of money that's still going towards that. So.
Specifically to Thunder Bay and Thunder Bay Rainy River, what kind of things are in the budget people can look forward to?
Well, one of the things, and it was already announced, was the permanent transit fund. Part of that is a rural transit fund, which I know Casper's going to be interested in. But that was already announced, so that isn't something really new. But certainly, we're hoping, and we still think that for Alstom and those jobs, that's really a big part of the answer, that we've committed that extra money. Now, it hasn't as yet materialized, but there seems to be a lot of moving parts between Toronto, the province, the feds, and Alstom, and the fact that it seems pretty clear that our government wants those jobs to stay in Thunder Bay. But that was already announced, but that's big for us. Another one that's been one of my big projects that I've tried to support, which I hope is going to come to fruition before the end of our government, the next election, is getting that chronic care home in Fort William First Nations. Peter Collins has been working on that for a while. I inherited it from Don Rusnak, but that would be 100 beds, which would be great for the municipality for a whole bunch of reasons. One, the hospital always has too many people in it who really don't need to be in it, but they're chronic care patients who can't find anywhere to go. So this would help to unburden the hospital to have 100 more chronic care beds in Thunder Bay. It would be the source of, I'm told, 100 new jobs, which would certainly be great, and it would be something that would be good for Fort William First Nations. But they're willing to they would take First Nations people, but I don't think they'd fill it up with that, and they'd take other people as well. And the same with people working there. It's not like it's just going to be only First Nations. It's for the whole city. So there was $6 billion more for Indigenous infrastructure, 4.3 for shovel-ready projects. Whether we can slot that in as a shovel-ready project. The big one, and the one that people have concentrated on maybe most, is FedNor becoming a standalone agency, which is, my understanding is, it's important. Now, do I know all the ins and outs as to what's going to be different as a standalone agency versus what it is now, which is directly under the control of the department? No, but I'm told this would allow them to have a lot more independence and make their own programs and their own policies. So how is this important? Well, I think, take the example of tourism and the problems faced by primarily the tourism industry in the west part of the riding. I mean, I think all of us have been affected, but those people out Fort Francis West have been severely affected because basically all their tourism comes from the American Midwest, and the borders have been closed. So there's 700 million more over, I think, 700 million over 3 years for the regional economic development agencies, which is new money. There's also 500 million more in tourism money, which is going to go through the regional economic development agencies. Now there's 5 of them in total, so they're not going to get all that money. But being a standalone agency, then hopefully they can make some programs and so as to help those who've been disproportionately affected. Because I think part of the problem in getting assistance for the tourism industry is all the tourism industry across Canada has not lost like 95% of their revenue like the people out in the western part of Thunder Bay, Rainy River. Places like northeastern Ontario, they did really well in the summer because everyone from Toronto couldn't go to Europe or couldn't go to the States, wherever they would normally go for their holidays. But instead, they're saying, where are we going to go? Let's go to Muskoka, or let's go to northeastern Ontario, stay somewhere there. And so they did okay. Places like Niagara, yeah, tourism was down. They didn't have American Ford tourists, but a lot of people in Toronto, St. Catharines and things. And so I think when our government looks as to where it needs to do more, when they consider the tourism industry, it's a bit of a mixed bag. But I think our area was particularly hard hit. Hopefully, with FedNor being independent, it'll give them more flexibility to, for example, maybe have some more non-repayable loans for the tour. I'm not promising that's going to happen. We haven't seen how the money's going to come out, but certainly I think they need more financial assistance than other tourism operators, perhaps in other places.
It's been really interesting to watch the numbers, the COVID case numbers here in Ontario. You know, there's 59 active cases in the Northwestern Health District. We're at about 50 cases or so in the Thunder Bay District Health Unit. Our numbers have seemingly dropped significantly. While Toronto remains a hot spot, Southern Ontario is just a COVID hotspot, and the cases keep climbing.
Yeah, no, our pendulum is out of sync with Toronto's pendulum. they're going up, we're going down, and then the opposite. Yeah, we've done a good job now of getting it under control. It was a bit of a wildfire there for a while, but Toronto's been a hotbed for a while. I mean, I was preaching that a while back, because, you know, there were numbers over the summer had gone down considerably. But I mean, I was saying, and within caucus, like, as long as in Toronto and Montreal, the fire's still burning, even at a low level, sparks are going to keep flying off, as it did happen, which it seemed like a transfer from a jail in Southern Ontario to us, and then it went to jail, and it went to the homeless pot. But that was a spark coming out of Toronto in that region, and we really have never, I think, got it under good control in Toronto, Montreal. So yeah,
I think one of the goals right now for a lot of us is, you know, today is going to be a nice day. We're heading into summer. We're going to get better weather, and we'll be able to get outside, get some fresh air, get some natural vitamin D, and that's good for our mental health as well as for just how we feel, you know.
Yeah, I think we'll be opening up. I mean, there is, and quite rightly, the province closed everything down for a period of time. I think that was necessary because we were facing a possibility that we had no more ICU beds. I mean, that's always been the concern from the beginning, that we not end up like Wuhan or the Lombardy region of Italy, where the hospitals were overwhelmed. You didn't have enough ventilators. We have the ventilators. However, the personnel to look after the ventilators. Now, I know a lot of hospitals have made provisions that they could increase the number of personnel by like sharing ICU nurses with med surg nurses and other people, so that you could stretch the staff to go further. But in some hospitals, I know Ottawa really prepared for that. But there was the kind of possibility, the nightmare scenario of people, even potentially fairly young people, having to say, well, we have no more ICU beds. Yep. So that I think that was driving a lot of the shutdowns, for example. The other thing that, and partly why certainly the UK variant contributed to that. But also, it's been from the beginning, there's been this uncertainty as to what the best vaccination strategy is. So, do you want to prevent deaths, first of all? Do you want to prevent ICU admissions, or do you want to prevent transmission? So if you want to prevent deaths, and that's what we did, and probably quite rightly, you have to vaccinate the oldest people first because they're by far the highest risk. However, somebody who's 90 is somewhat demented, 85, if they get COVID, they're not going to go to the ICU. So if you want, so a lot of the people, and we had a lot of deaths in Thunder Bay, but a lot of those deaths never got to the ICU because they were people who were very, very old, who some of them may have had some dementia and things. And so those people, it's not just COVID, but if you have the flu, you have pneumonia, you're septic, and you're that age, mostly we don't put them in the ICU. And you know, because I did this for a long time. So COVID's no different. So anyhow, but the people that do go to the ICU are the 50, 60, 70-year-olds who were further down the line in getting vaccinated. And then there's people like the frontline workers, the people work in Walmart, the teachers, and people who have a lot of contacts in, and do we vaccinate them? But, and especially with the UK variant, people seem to get a little sicker. It's a little more contagious. So, but that's partly what's fueled the ICU rise, is because, yeah, deaths have come down, the number of chronic care homes has come down, but because we were vaccinating the older people, rather than selectively saying, no, let's go for the 50, 60, 70 to protect the ICUs. So
it's always interesting. There's going to probably, once this whole pandemic is over, there's going to be a need for a serious look at everything that's been decided and done, planning for anything that'll happen in the future.
Absolutely. We did that before with SARS. How much we learned our lesson, I'm not sure. That's the nature of life, though. I mean, it's like you have a disaster or something, or you have a problem with your house. You decide, well, I better get insurance so this doesn't happen again. And after about 15 or 20 years, you're paying your insurance, and then you say, well, this doesn't seem like such a good use of my money, because like, what am I getting back? So let's just cut the insurance, and then you get hit. So similarly with SARS, we were prepared for a while, and then obviously as the news coming out, we kind of let that lapse a bit. I think that's just human nature, and the fact that certainly there's other competing interests for our money. So, but absolutely, both our government, every government, I think there has to be a total review of how everyone managed this, from what happened in the hospitals to what happened in the province to what happened at the federal government level. This has obviously taken billions and billions of dollars out of the economy, created debt that we're going to be paying for a long period of time. And this is medicine. I think always in medicine, whenever anyone dies, when there's a bad outcome, you have to look back and say, could I have done something better? And I think similarly as a healthcare system, I think we'll look at this and as public health and say, how could we have done better? And I think always, and if you're worth your salt. What's the word? Worth your weight in salt. You, as a doctor, like you stay up at night thinking about, like, maybe I could have done this different. Maybe I could have done that different. But I think similarly with health systems, we ought to be doing the same thing. Once it's over, to be looking at it and saying, well, how could we have done this better? But both, not only nationally, not only locally, provincially, nationally, but also internationally.
Yes.
And there has been a call for a global treaty on pandemic preparedness and response, which I think Canada ought to seriously be looking into. So next time this happens, it's not this piecemeal approach across the world in dealing with this. I think we could have done way better globally.
Marcus, I think we'll leave you off with a message for here in Thunder Bay Rainy River.
A message for people in Thunder Bay, Rainy River. Summer's coming. It's a great sunny day today. We thought this was going to be a marathon, COVID. It turned out to be a 1,500 meters. We're like at the 1,300 meters. A lot of people are kind of, I can't make it. I can't make it. The end looks so far away, but it's pretty close. And as of last year, this time where most people were talking about 2 to 3 years to get a vaccine, the vaccines, and so many more people are getting their vaccines now. I don't know about you, but it seems like a lot of people are suddenly, you're hearing, I'm getting my vaccine. I'm getting my vaccine. So I think with the warming weather, I'm thinking by May it's going to be, and we're a bit, because we're in Ontario, we're having to do what Toronto needs to do. But I'm thinking by May we'll be sitting out there in the sunshine with other people drinking a beer. It's not time to throw away our masks and stop, and that'll take a while, but life will look a lot better in another month or 6 weeks when you're sitting outside with your t-shirt on, having a beer, and looking at it. And before, last summer when we were doing that, we still knew that it wasn't over, but I think now we're going to be looking at life getting better and starting to resume our old way of doing things. So life will get better. Like, just hold on to the end, keep doing the stuff you're doing, isolating, get your vaccine. Absolutely.
Marcus, thank you again.
Okay, nice talking to you.
Take care. I'm working just a second here. That'll do the trick. I think we got her. To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.